Madam Chair, I'd like to move House File 3639 to be laid over.
Thank you, Mr. Chair. We do have before us now, members, House File 3639, and Chair Noor has moved that House File 3639 be laid over for possible inclusion. And with that, not seeing any amendments, we can go straight to Chair Noor.
Thank you, Madam Chair and members. I think we have had from the experts from NCSL and others about the social drivers of health waivers. This is going to be more inclusive. Right now it says food insecurity, but this will be added with the housing component, hopefully, through amendment. So this bill is in our jurisdiction, so we're trying to make sure that it's more encompassing. We've had from many advocates, so I just wanted to give my testifier the opportunity to testify on the bill.
All right, and it looks like we have Sarah Peterson, if you'd like to come on down to the testifier table. Welcome. Go ahead and get comfortable. Then if you could say your name and your affiliation, and then go ahead and proceed with your testimony.
Thank you, Chair Bonner and members of the committee. My name is Sarah Peterson, and I'm the Director of Neighbor Services at Second Harvest Heartland. We're pleased to support HF3639, which will begin the 1115 demonstration waiver process for health-related social needs. At Second Harvest Heartland, a member of the Feeding America network of food banks, we believe in the relationship between food access and good health outcomes for our Minnesota neighbors. In addition to the nutritious food and fresh produce that we distribute in the community via the Emergency Food Distribution Network, we also connect food insecure neighbors to many programs that help ensure longer-term access to food. And one such program is FoodRx, our version of food as medicine. Since 2018, the FoodRx model of care has built meaningful connections between patients, healthcare partners, and food security solutions. FoodRx aims to improve self-care management for members with diet-related chronic diseases and increase their food security through the provision of medically tailored groceries delivered directly to their homes. We also offer SNAP assistance and referrals to address other health-related social needs. We currently partner with multiple insurance payers that offer FoodRx as a benefit to members that are on a medical assistance or Medicare plan, like Minnesota Senior Health Option. We've seen great success in enrolling their members into the program and high completion rates. They have reported on improved clinical outcomes and engagement with the healthcare system among FoodRx recipients. So we know this model works. Lastly, I'd like to share a participant quote that reflects a lot of the feedback we receive on how this program benefits health and budgets. The program has completely transformed my life for the better. I have now tried tofu, wheat noodles, and beets, which I would have never tried before. Mentally knowing that I have something to eat when I wake up in the morning has made a world of difference. Your support of the 1115 waiver will allow more Minnesotans to have that peace of mind that comes with stable access to nutritious food. Thank you for your time.
All right, thank you, Ms. Peterson. And with that, we have Megan Peterlentz, if you'd want to come on down. Wonderful. Welcome, Ms. Peterlentz. Hopefully I'm saying that correctly. If you want to go ahead and state your name and affiliation for the record and go ahead and proceed.
Thank you, Chair Bonner and committee members. My name is Megan Peterlentz. I am the Community Affairs Manager at Children's Minnesota. I appreciate you having me here today to express our support for House File 3639, which would initiate the process of Minnesota applying for an 1115 Medicaid waiver to address health-related social needs. Children's Minnesota is the state's largest pediatric healthcare system. We serve a diverse patient population, and nearly 50% of our patients are enrolled in Medicaid. Our vision is to be every family's essential partner in raising healthier children, and that starts with recognizing that 80% of what impacts the health of a child happens outside of our hospital and clinic walls. Equitable access to social supports, including food and housing, is essential to ensuring the health and wellness of children and their families. We know that children experiencing housing instability or food insecurity are at higher risk for developmental and academic delays, as well as behavioral and mental health challenges. In my role at Children's Minnesota, I have the privilege of leading our community health needs assessment process. We conduct an assessment every 3 years in compliance with federal law. These assessments are one of the ways we engage the communities we serve and respond to what they want us as a healthcare provider to prioritize when it comes to their health and wellness. I am here testifying before you today because access to basic resources like food and housing continues to be elevated through this process. Another way we learn about families' health-related social needs are when they participate in a social needs screening in one of our clinics. Food insecurity and housing issues are regularly identified as top concerns. Families can meet with a community resource navigator through our Community Connect program to help address those concerns. If nutrition and housing supports were paid for by medical assistance, our capacity and the capacity of our community partners to support these families would increase in an incredibly impactful way. Our communities are telling us what they need to be healthy, and Children's Minnesota, along with hospitals and health systems across the state, are working to be responsive to those needs. This waiver gives us the opportunity to use current systems to invest in what we know supports families' health and overall well-being. Thank you, Representative Knorr, for your leadership on this bill. We look forward to working with you and other stakeholders this session as the bill continues to evolve.
Thank you, Ms. Peterlins, for your testimony. I do not have any other testifiers listed. However, I would like to check in with the public at this time and see if there is anyone else in the room that would like to testify on this bill. All right. Seeing none, we're going to go ahead and move to member discussion. And I have Lead New Brindley on the list.
Thank you, Madam Chair. Thank you. Representative Norton, the one thing I'm thinking about is, do you have any, it may just be speculation at this point, but how this might interact with SNAP?
Madam Chair,
Mr. Chair.
Lead New Brindley, I think this is a different model. So we're talking about food as health in terms of providing people with specific food items, which is authorized under the Medicaid. So when you see someone who's got a mental health, behavioral health, and all that component combined together, just to take an example, somebody who just left the jail through the pre-release program, they need housing, they need case management, they need food. As part of the program, it's going to cover the food component of that. Maybe I need to phone a friend to get more clarification on some of those other issues. I don't know if we have an expert in that process.
It looks like we have someone ready to come down and assist. Okay. All right. Thank you. If you, once again, we could state your name for the record and go ahead, proceed.
Yeah, absolutely. Thank you, Chair Bonner. My name is Sophie Wallerstedt. I'm the Public Affairs Manager for Second Harvest Heartland. And Representative New Brindley, that's a really good question. So SNAP is a federal program that people qualify for through their income. It is paid entirely by the federal government. And I don't think there is going to be a specific interaction between SNAP and this 1115 waiver. Instead, what they're looking at is specific populations that they could figure out interventions, like nutrition interventions that would work for them. So for example, I know Representative Knorr was talking about folks that are leaving the criminal justice system, but if you have, for example, like a pregnant person who is at risk of homelessness, like making sure that they have access to nutritional food or nutritious food or prepared meals. So it would be in addition to any SNAP benefits if that person qualifies for SNAP.
Madam Chair?
Yes, Mr. Chair.
This program is not meant to supplement what we're doing. This is intended to be more specific. So for that matter, I think if someone is eligible for a SNAP program and getting the SNAP benefits, it's going to be different. This is more medically tailored food program or meals for that individual.
Thank you, Mr. Chair. Lead New Brindley.
Thank you, Madam Chair, and thank you for that. I mean, I assume that obviously this will all be laid out in the waiver application, but I do wonder if that creates a little fuzziness for folks who qualify for SNAP, because I think logically this would supplant some of that instead of supplement. So that's something we probably just need to make sure is crystal clear, and then there won't be any fuzziness around, because I do remember in Ms. Costanza's presentation, that was an important piece of qualifying for these waivers, is that it must be in addition to, it can't supplant. But I am trying to imagine a situation where this wouldn't supplant. Like, it just seems like logically it would almost have to. Either that or there would be an overabundance maybe. So just something to consider. Thank you, Mr. Chair.
Mr. Chair.
Thank you, Madam Chair. Lee New Brinley, one of my criteria has always been federal fund first. So if the SNAP program is paid through the federal program, that will be the first benefit to look into before the other nutrition programs that are going to be included in that circumstances. So if someone is already eligible, they may need the housing support, they may need the case management, they may need to look into other social services that are needed to make sure that we can stabilize the life of that individual so they can thrive. So this is more of a 6 months transition, while SNAP program may be ongoing. It's an income-based and so many other things. So the target here is to make sure that individual can be stabilized and transition to other things within that 6 months.
All right. Lee New Brinley.
Thank you, Madam Chair. And thank you for that clarification, Chair Noor. And perhaps that really is addressed on lines 1.1 and 1.12, whose nutritional needs are not being met by other food support programs. But so perhaps that will solve that problem. Thank you, Mr. Chair.
All right. Thank you. Lee New Brinley. And Representative Fisher, you have a question.
Sure, thank you. I'll keep it real quick. So the way I'm understanding the food component there is I could think of somebody who is about to be discharged from a hospital that was in, say, for diabetes, where they had a severe reaction, or stroke, and they have to cut back on sodium or sugars and those kind of things. A lot of times the meals you have to go to are usually a bit more expensive, and also learning how to cook differently and how to get meals in that kind of situation, because I know so often people are used to getting the prepaid stuff, the pre-prepared stuff, which is high in sodium, high in sugars. So this is getting to that component of making sure that they're being able to get the right products that may cost more expensive than just going to the prepared stuff out there.
Mr. Chair.
Madam Chair, Chair Fisher, I think that's exactly why we needed this program. This is medically tailored meals to those individuals who need it. So it may not be for everybody. I know we have got the other programs for folks who have specific foods that are also funded through SNAP program. So this will be a little bit more of a difference from those who are receiving additional programs.
All right, thank you. Representative Fisher, okay. And I do not see any other members on the list. Is there anyone else with questions for Chair Noor? All right, well then, seeing none, then we will renew the motion for Chair Noor to move House File 3639 to be laid over. All right, the bill is now laid over.